In our communities, we don't access a doctor until it's too late. We prioritize the things that we need the most, our basic needs, because they're living sometimes paycheck to paycheck. And so that one catastrophic illness just throws the family off completely.
Well, it affects us all when people don't have access to preventive care and health care in a couple of ways. Eventually, if the person gets sick enough, they'll end up in a hospital emergency room, and those costs will be much higher. The person will be much sicker, and those costs don't just disappear into the ether. They are either paid for by taxpayers or with charity care dollars from hospitals that then try to make up those dollars on their paying patients. So we're all paying a cost when someone doesn't get to access health care in an orderly way and with prevention at the forefront.
If people don't have the things that they need to live a healthy life, affordable quality housing, equitable access to transportation, and access to fresh fruits and vegetables, then it becomes more expensive later on down the road. Because things that are preventable can be low cost, just visiting the doctor, for example. Instead of waiting, then it gets more expensive for the family, and it can be catastrophic.
And what's interesting in our surveys, do you agree or disagree, government should take action to reduce the income differences between rich and poor in America? Went from 25 to 30%, 40, 45, 50, 60, 78% in the survey this year. And so you can watch a general population recognizing that people in America today are poor because of circumstances they can't control. We've got to have access to health care. We're the only industrial country in the world that doesn't. We understand that. There's more support for government programs now than there's been at any time since the 1980s. And we need public-private partnerships, which we're very good at in Houston. We need commitment. We need investment. We need determination to say the future is not automatic.
In Houston, because we have such a large medical center, we tend to conflate health and healthcare. They are not the same thing. Health is the goal we're after. Healthcare is one of many mechanisms or pathways to achieve good health outcomes. And if we focus on health as the outcome as opposed to health care, then we would look at the opportunities to improve people's health and to prevent adverse health situations in a different way. We're really good at fixing people who get very, very sick. We are not good at all at keeping people healthy, and we have financial incentives in place in this country where there's a lot of money to be made off of people who are really sick, and there's just not really money to be made off people who are healthy.